A recent investigation about Johns Hopkins All Children's Hospital sheds new light on what's going on there. The report put the hospital in, quote, immediate jeopardy. That's because inspectors found an immediate or serious threat to patient health and safety. Today, 10 News reporter Liz Crawford started digging in on that report. And Liz, you actually found some alarming details in a letter that was sent to the hospital.
Yeah, well, according to the Centers for Medicare and Medicaid Services, or CMS, Johns Hopkins All Children's Hospital failed inspections in 4 areas. First, governing body. Number 2 here, quality assurance. Then we're looking at medical staff. And number 4, infection control. We're still waiting on the detailed inspection reports, but we know it's bad enough to determine a threat to patient safety. So let me catch you up to speed on how we got here. First of all, it all started last month. There was a federal inspection January 7th through the 11th. The findings were so bad that it put the hospital in, quote, immediate jeopardy. So what happens now? Well, this is what we're looking at. The hospital has until February 10th, just 5 days from right now, to outline a specific plan to fix the issues. Their plan of correction then has to be accepted. Once it's accepted, investigators will go on site unannounced to verify corrective changes have been made. Now, if that plan is not accepted, the hospital will lose funding effective February 23rd. So we're looking at 2 key deadlines here. Now, keep in mind, in December, the president and CEO of Johns Hopkins All Children's Hospital resigned, along with other high-ranking staff members, after a disturbing investigation by the Tampa Bay Times. The investigation found warning signs were missed about problems in the hospital's heart surgery program that led to child deaths. Again, if the hospital doesn't fix the deficient issues, they'll be terminated from Medicare participation and could lose all public funding.
And a hospital spokesperson told us the facility is working closely with state and federal agencies to immediately address the concerns.